I am Dr. Onesmo Balemba from the University of Idaho. I was invited by the Digestive Disease Week administration to give a presentation about our abstract entitled Garcinia buchananii bark extract is an effective anti-diarrhea remedy. This abstract will be published in the Journal of Gastroenterology. With me is Mr. Paul Boache, a graduate student from my lab who performed most of the experiments. Diarrhea is a significant health burden in the world, particularly in developing countries where over 2 million children die of diarrhea every year. Oral rehydration therapy is the recommended treatment for diarrhea. However, this treatment does not reduce pain or shorten the duration of the illness. Garcinia buchananii bark extract is a traditional remedy that is widely used in sub-Saharan Africa to treat diarrhea and associated abdominal discomforts and pain. However, we do not know the effectiveness, the bioactive components, the mechanisms of action, and safety of the extract. The goal of our study was to determine the effectiveness of Garcinia buchananii bark extracts and its bioactive components as treatments of lactose-induced diarrhea in rats.
We induced diarrhea in 10-week-old Western rats using a diet containing 35% lactose over a period of 6 days. Garcinia buchananii bark powder, ranging from 0.1 grams to 5 grams, dissolved in 1 liter of water, was then used to treat the diarrheic rats. 10 milligram per kilogram of a standard anti-diarrhea drug called loperamide was used as our control. Preparative thin layer chromatography was then performed on our extract, and this was to help us to isolate and determine the various compositions found in our extract. The effect of the isolated fractions was then tested for bowel motility using gastrointestinal motility techniques. Phytochemical analysis was then performed on the bark powder. Now to our results. Diarrheic rats were characterized by wet, loose, and watery fecal pellets. They also lost weight ranging from 5 grams to 10 grams over a period of 6 days. Significantly, less than 24 hours after treating our diarrheic rats with the varied concentrations of Garcinia buchananii bark powder, diarrhea was completely stopped. Rats treated with 0.1 gram Garcinia buchananii bark powder recovered from their diarrheic condition gradually, but consumed more water, food, as compared to the other groups of rats. However, rats treated with 1 gram, 5 grams, and loperamide recovered more rapidly from their diarrheic condition. Interestingly, rats treated with 1 gram Garcinia buchananii bark powder produced more fecal pellets. 5 fractions were identified using preparative thin layer chromatography. 2 of these fractions were seen to have anti-motility effect, whilst 1 fraction had a prokinetic effect. Upon conducting phytochemical analysis, flavonoids, tannins, alkaloids, and steroids were identified in both the anti-motility fractions and in our extract. It is worthy to note that these general classes of compounds are known to have anti-diarrhea properties.
So in conclusion, Garcinia buchananii bark extract is an effective anti-diarrhea remedy, and its efficacy is comparable to that of loperamide. Garcinia buchananii bark extract contains components with anti-motility and prokinetic effects, and therefore these components are suitable for treating diarrhea and constipation. These findings support our previous findings, indicating that Garcinia bark extract slows bowel movement by inhibiting neurotransmission in the bowel. This study was supported by the University of Idaho.